Today we're going to be talking about low birth rates and how we can view them from a biological, cultural, and environmental standpoint. An infant that is at a low birth rate is any infant born in less than 5 pounds and 8 ounces. Starting off with our biological approach, we can see we have most of our dependent variables here and then our independents in our cultural and environmental sections. So starting off with genetics. If a mother is coded for genes with low birth weight, then her child will have a low birth rate. When I was doing some research on this, I found out that the average American baby usually weighs more than the average Chinese baby. So different genes of different ethnic groups can code for the birth weight of infants. Moving on to the age of the mother. The age of the mother plays a crucial role in the birth weight of the baby. So if a woman were to give birth to a child in her late 40s, maybe 45 or so, the infant would be at a higher risk for having low birth rate compared to if the woman gave birth between anywhere up to 20 to 40 years of age. While doing research, I found that, and like we studied in the previous chapters as well, that the body of the woman ages, and over certain time, certain complications can arise when you give birth to a child later on in life. Moving on, we have nutrition. Nutrition is a very important part in pregnancy, which we also studied in previous chapters in this course. We saw how important it is to eat, and if a mother does not eat properly, she can have morning sickness as well, or morning sickness can be as a way to get the mother to eat more nutritional foods that will benefit the baby. So the less nutritional food that is eaten during the pregnancy can also lead to low birth weight because the infant needs the nutrition in order to grow properly inside the womb. Another biological factor is hormone levels. We also learned about the hormone levels that regulate pregnancy, such as progesterone and estrogen. If these levels are low or imbalanced, it might affect the growth of the embryo, which can also lead to a low birth weight. Moving on to the cultural realm, the only aspect or fact that I was able to find for this was breastfeeding. While I was doing research, I found that different cultures view breastfeeding differently, and the less you breastfeed your child could also lead to the baby having a low birth weight versus giving your child more nutrients through breastfeeding can help the child grow and give it more weight. Moving on to the environmental aspect, I found information about tobacco smoking, cigarette smoking, and living in a toxic air environment. So as we know, when you're pregnant, you should not smoke or drink. The chemical toxins that you breathe into your body will affect your child, as well as cigarette and tobacco smoking. So this will lead to deformities in a child, and one of the deformities can be low birth weight. Also, living in a toxic air environment where there's constant air pollution can also cause the same issue. The environment that you live in while you're pregnant does play a very important role, not only physically, but psychologically as well. So if you're constantly surrounded by all the fumes that you're breathing in, not only is it not healthy for the mother, it's also not healthy for the child. And a side effect of this can cause the weight of the child to change, leading to a low birth rate. So this is a general overview of low birth rate and looking at it from a biological, cultural, and environmental point of view.